but I never believed that my knee could actually recover from that. I thought I'm just going to have this thing that I have to watch out for, and someday it's going to just, put a stop to everything. And so it's taken a long time for me to entertain the idea that, you know what, I think that I could actually get over this thing.
Fourth here. All right. So, hey everyone.
Hey guys,
This is Raul,
I'm Coach Jay,
and this is Joint Effort.
got a special one for you guys today. It's our Phase 4 roundtable, and we got some great all stars from our knee arthritis recovery group and our hip arthritis recovery group. So, welcome, guys. Marianne, Christina, Bonnie, and Barry. Welcome, guys.
So, we want to start with this podcast by interviewing all of us, all of you guys here. Let me start with Christina, who is on the knee arthritis recovery program, Phase 4. We're gonna be moving on to Bonnie real quick. She is Phase 4, Lord, I would say Phase 5.
Yeah.
Also knee arthritis recovery program as well. But Marianne, who's been a long time Phase 4 person here, like also already working with a trainer, well, has been working with a trainer for a while. And Barry, who is going to join you guys, but in a different program on Phase 4 very, very, very soon. So, guys, let's talk. I think this is where we are going here. Let's start with Christina. You recently went on a trip to Copenhagen, and you were managing your arthritis over there. How? I want to ask you about how things went there, and then I want you to briefly take us back to the beginning of where when your knee used to just swell just from living, just from existing.
When I was just in pain. And I didn't.
Yeah, where you were just in pain.
Yeah. Yeah, sure. Yeah. Hi everyone, and thanks for having me, inviting me. This is fun. So I just went on a trip to Copenhagen, and I was telling Coach Raul about it and how everybody's very healthy there, and we signed up for some tours, and they were walking tours around the city, and I was shy about telling the guide that I can't be on my feet for 4 hours walking around, and I didn't, you don't want to be that person. And I went in, already stressed from the travel and walking around airports, and it was about 2 days of travel to get there. And then the next morning getting on a walking tour and flaring up my knee nice and even with swelling, which was unusual at this phase now. And but never fear, I'm almost coming up on a year on this program, and I knew what to do, and I knew I needed to get off it, and I rest and ice, and which is what I did. But thinking back to like where I was a year ago, I think it was January I started the program. I went into this program. I just happened to find you guys online, Dr. Davis videos. I was thinking the reason I was looking around online was because I was thinking I'm gonna have to go call and sign up for knee surgery. I'm in too much pain. And he was the first one that started talking about what you can do instead of jumping right into surgery. And he started talking about, this is what you experience. I know you go to this and they tell you this, they say you got a few years, we're going to send you to PT. And then, and that's great. You can try that. And then you come back, and then you come back for the shots. And then, we want to wait. We don't want to jump into the knee surgery right away. It was like, this is your path that you're going to be on. And it's very surprising. Yeah. And I did the PT, and this was prior to this was a while before I was in that place in December. But I tried all that stuff. I've been trying everything. And then there's a lot of judgment of people like, well, maybe if you lost a few pounds, there's a lot of that judgment. And then I sign up for your program, and I'm getting stuff like, no, again, reiterating that process. I'm like, how did these guys know? That's exact. And then you hear everybody else on the call going, yeah, that's exactly what I was told. I was told, I'm bone on bone, and ooh, that's scary, and better sign up for surgery. And And then we get on these and like you guys are talking, you're cautioning about using Advil and things, which I had been told to take all the time. And I have people that have ended up in the hospital from taking too much Advil. I mean, not like a lot. It's bad. It's not, it's there. You got to understand this isn't just something you slap over, the pain. It's a muscle imbalance. And so anyway, so it's just been like a whole change in my life and perspective, and to first get hope that maybe I don't want to have surgery if I don't have to, and just being able to think maybe I don't, have to, or maybe I can I'm going to see what these exercises do. And I've been doing that now for a year, and I have no plans to have surgery at this point. So that's kind of where I am.
But whenever you run into these moments where things just aren't feeling too hot, you mentioned earlier, you know what to do now. And I think that goes a long way.
Yeah, we know what to
A
do.
little bit about like calming down, kind of using that phase 1 as your first stage and getting yourself feeling good enough to enjoy the rest of your trip.
Prior to me, and it's a big educationist program, and it takes work. It's like going to school almost, and you have to go through the stuff in addition to doing the exercises. But in the past, if my knee would have really flared up like that, I would have been putting the like Voltaren on it, taking Advil, and probably that's about it, because that's what I knew what to do, and then thinking I need to call for surgery. But when it flared up in Copenhagen, and this isn't the first time it flared up, because I went on another trip in the summer, but I had all my basket of tools. Oh, just like Jay, you talked about. I love that. And I just applied those. I had all my braces I brought with me. I knew I had to get off and ice it. And in fact, the next day, I told my husband, I said, luckily we had a beautiful room with a view. So I just sat there and enjoyed the view in the bed and rested my knee. I said, I told my husband, go ahead and walk around. And he went and walked around himself. And he's very supportive. It's also education for your spouses too.
Yes.
Yeah. He would always remind me, you got your brace on, and he actually then started telling the guides following that, my wife needs to sit down. So and then I started to tag on and go, yeah, I do. And then I also mentioned this on the call, something is really significant for me. I figured out to use the word injured instead of I have knee pain, or my knee's a little sore. I started telling people I injured my knee when I first got here. I can't walk too much. And the difference was amazing just in the change of that word. So
that's beautiful.
Yeah. Speaking of adventures, because this was kind of the second adventure that Christina had gone on. Like there was another trip, but we have another very adventurous person in this podcast with us today, which is Bonnie. Like, and I want Bonnie to just introduce herself. I just gonna talk a little bit about how you started like this program, because I just give you guys like a little hint. We didn't start working on her knees. That's not where this started.
Okay, so thanks for having me on here, and if anything I say helps anybody, I would be really happy about that. But so what happened with me was, I reviewed my history the other day just so I would remember what happened when. And in 2014 was when I had my first knee X-ray on my right knee, and they they didn't say bone on bone at that time, but they said, this PT said, now look, think of your knee as having like a limited number of steps left in it. So make sure every time you take a step, you're taking out, and they'll never be returned. And so you should, so never walk more than 5 miles on one day ever in your whole life. And here I was a backpacker. That's my thing. In 2014, 2012, I started backpacking, and I loved it. I just love it to pieces. It's just the greatest thing in the world. I love it. And so I did not listen to her, and I kept going, and I was pretty much fine. And then what happened was in 2021. Oh yeah. Then I had, 2021, I had, that was during the pandemic. The gyms were closed, the parks were closed, you couldn't go anywhere. And so a friend of mine told me her workout she was doing. And I said, oh, tell me what you do. And so it included a weighted squat. And so the first thing I did one morning, I did this weighted squat and something bad happened to my knee. And it hurt. Like I felt this pulling on the inside of my right knee. And I'm like, oh no. And what I read when I was looking at my notes, it said it swelled up alarmingly. And so
Oh, my
so,
God.
so now I went to the doctor, I had x-rays, and I don't know, they patched me up somehow. So I kept going. I didn't,
Yeah.
so then 2022, by then I found Dr. David because I typed inner knee pain, and there he comes with the videos. It's something like, fix your knee pain in 3 minutes. I'm like, okay. It had the donkey kicks and the fire hydrants, and I did it, and it really, I was amazed. Like the whole, get your glutes going and downplay your quads, and it worked. So I was back. To me, I was cured, and so I hiked and backpacked like crazy that year, 2021 and 22. Oh my God, so much backpacking. And then one day in 2022, I was climbing up something and I kneeled down on my knee and said, went pop, 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 pop. I'm like, uh-oh. So I thought instead it felt good at that time. Like it felt better. I thought, oh wow, I can move it easier. And so I just kept going. And then, but what happened was loose bodies were floating around in there. So the whole time this is happening, I'm still backpacking and I'm still hiking all the time. And what happened was I was so happy with El Paso Manual Physical Therapy and looking at the videos all the time. And then I noticed the shoulder program. And I said, hey, I bet that's a great shoulder program. Because I felt kind of cured with my knee, right? Because if I just keep doing the glutes, I'm all done. So I joined the shoulder program because I've had surgery on both shoulders and they were pretty good, but I knew that I was careful and I wasn't really 100% sure I could trust my shoulders. So then I was doing one-on-ones I did the program and then I did one-on-ones with Raul and I progressed through and it was great. And we come to phase 4 with deadlifts. I'm like, well, I can't do any deadlifts because I can't squat. And so he's like, what do you mean you can't squat? It's like, I can't, my knee. And so he's like, you need to be in the knee program. And so I said, okay. And now I realize I believed that and actually this took me the whole year in the knee program to learn that I'm happy the way I was, but I never believed that my knee could actually recover from that. I thought I'm just going to have this thing that I have to watch out for. And someday it's going to just, put a stop to everything. And so it's taken a long time for me to entertain the idea that, you know what, I think that I could actually get over this thing.
Yeah.
And it's the knee group that got me to understand that and also push through fear of, because I love backpacking. And if the day comes where I can't do it, I don't want to have that day. So there's always this high stakes in my mind and some of it's subconscious. Like, so I'm really afraid to I still haven't done deadlifts. I mean, I'm not quite done with phase 4 because I am very careful with those squats. And so, but I'm making progress.
Yeah, you are. It's
yeah.
good to think of now that you're mentioning weights, like so someone who's been lifting weights for a little while is Marian. And so that's someone that Marian, can you introduce yourself to everyone and tell us how you found us? Because I'll briefly touch on this. Like Marian started on a program that's not even about knee arthritis.
No, exactly.
We have a program that's just about wellness. It's just a 28-day knee program. And that's how we started working together. But Marian has been in the gym for years now, working with a trainer. So can you talk to us, like everyone on YouTube too?
Yeah, well, I started when I was a kid. I was a dancer, did ballet, tap, and all that kind of thing. And ballet really is, when you look at it, it really is more of your the front of your leg as opposed to your glutes.
Yep.
And then I rode horses. And so I had those two events and I was training to be a New York Rockette when my horse fell on me and broke my left leg, my foot. And so that cut my career, and it took me, you know, a long time to come back from that. And I've had several operations because the first guy didn't do a very good job, and I've had my toes wired and all that kind of stuff. But anyway, so yeah, I went to the gym thinking, you know, I'm going to do this and I'm going to rebuild. But the trainer I had at the time, not the trainer I have now, was mostly, they didn't even talk about glutes. You know, they do talk about the front of your
Squats, right?
yes, and it's squats and this and that. Yeah, and then one day my right knee just went out, and I just couldn't walk, and then I went to the doctor, and he said, you know, you've got bone on bone, you know, you've done all this all your life, and you know you're going to have a knee replacement. And I said, no, I'm not. And he said, yes, you are. You know, so I started searching for some avenue, you know, and because a lot of trainers, they don't know about glutes and about how powerful glutes, they really don't. So I fired that trainer, got a new trainer, and I told her about my knee problem. She said, yeah, we need to work on your glutes. And not even, this is just before I even found El Paso. And then I kept looking around, and I finally found on YouTube, you know, Dr. David. And then I networked with my trainer now, Marina, and told her about, she says, well, let's work together with them. You tell me what they want you to do, and we will do it, but I'm going to make it harder. And I'm going, oh, great. So with that, and, you know, every time I would go to train with her, I would do my leg swings, you know, my the tailgate swings and all this kind of stuff, and telling her what I learned. She said, fine, you know, we're just going to do more. And, you know, you let me know, you know, how it goes. And between the two, with El Paso and her working with us, because she's from Russia, her training is far superior. A lot of trainers here in the United States. I'm sorry, but there are. And she recognizes a lot of PT people don't know about the glutes and how to do it. So she recognizes that. So it's been a long journey, but you know, and I improve all the time. So that was my long journey and how I found him.
That's so cool.
Why?
I would say, Marianne, you've just been a very special person in our community. You know, you answer a lot of questions that the new people may have, that you offer a lot of advice, and that's been very crucial. And another person that's done the same thing is Mr. Barry, who's on our hip arthritis recovery program. Barry, tell us a little bit about your situation and kind of your origin story, my friend.
Introduce yourself to the ladies, please. Like,
Yes, sir.
Hi, I'm Barry, 71 years old. And I basically got into this program because I got sick and tired of having no more sex, drugs, and rock and roll. What the hell's with that? Life's too short. Anyway, yeah, I've been in this program now for 7 months, the hip recovery. I got into it like you three ladies that have found Dr. David on YouTube. And I was looking around for something because I'd had sciatica for 6 years, kept getting worse and worse and worse. And I laid out the money and the time and the effort for chiro, physio, laser, acupuncture exercises, and none of it was helping. And then all of a sudden last fall, I got bad pain in my groin. And I said, well, this is not sciatica. So I went and checked it out, and it was arthritis, both hips, lower back, both SI joints, torn labrum, loss of cartilage on my femoral head. And so I got serious about, and it was preventing me from running my household and looking after my family and whatnot. I couldn't do anything. And I went online to get, and I found Dr. David, and I looked at one of his videos. He actually mentioned the hip recovery program, and I looked at it, and it made complete sense to me. And it was actually a plan, you know.
That's Mr. Barry.
And I've said this many times before, and I'll say it again. One of the things I've always believed my whole life is failing to plan is the same as planning to fail. Yes. And all these other people I went to, you know, they didn't have a plan.
Mhm.
And so I said, you know, this looks like there's some intelligence behind it,
Yeah.
and really and common sense. And actually did go to an orthopedic surgeon, and he looked at me, and I told him all about this. And he actually said to me, I want to know the name of that doctor and the name of that company. Because what they're telling you to do right now is exactly what you should be doing. So, so I consider him one of the good guys.
Yes.
I started with the program, and my sciatica pain has always been worse than my hip pain. And between the combination of the two of them together,
Mhm.
there went my stability and my mobility and the pain. And I was getting run down because I wasn't sleeping for months, because the sciatic pain would kick in at night and it would be an 8. And I'd have to take oral and or topical strong painkillers, or I'd lie in bed till 4 in the morning when my body just finally made me pass out. And so I started, and and I just did exactly what these guys told me to do. I didn't try and figure anything out for myself whatsoever. I've never been a person to go to the gym and work out. I'm active, but I've never done that. And I just too damn lazy to bother looking up anyway. So I followed their program, and after a month, I was able to go into phase 2. And I was in phase 2 for 3 months. And so at the end of that time, I always understood this would work, like logically, but I didn't really believe it would work.
Yeah.
Before, until that point, I always say this. I said, well, I wonder if Dr. David really knows what the hell he's talking about. So after 4 months, I believed he did. And that's when things turned to, that's when I started to engage in the community. Because I'm not a computer person. I do not do social media ever of any kind, and I never will. But I started to become engaged, and that was a turning point when I saw all these other people that were doing going through what I was going through, and a lot of those people had some really, really good ideas in the program that I started using and helped me. And so one thing led to another, and now I'm actively participating in it, and I'm a month and a half into phase 3. I'm going to probably start phase 4 in January.
Wow.
But from where I started in the spring and April, where I couldn't do anything, I couldn't go out and rake my lawn this spring because it only lasted 10 minutes, and the pain was so bad I had to quit and hire someone to do it.
Yeah.
Now this fall, I can do everything that has to be done.
That's amazing.
Yeah.
I got a book. I'm in Canada. Because our
Mhm.
winters are so cold and so much snow, I got a book with a list of 38 items that have to be done to my house, yard, and car to prepare for winter.
Yeah.
38 of them. So many, I write them down so I don't forget. So
Yeah.
This fall in October, I did all 38 things myself, did them properly, did them without did enjoy doing them, did them with minimal amount of pain.
Mhm.
So it's a 180 degree from April to October. So
That's awesome.
You can't put into words the gratitude that I have for what this program has given me.
Oh, man. We're very grateful that
And
you're
you and
trying-
Jay and Rao and Dr. Dave, the three of you guys, you've worked magic.
Oh, man.
So that's my
Love you
story, and I'm
guys.
sticking to it.
Yes, sir. Let's dive in. We got a little bit of time here.
Yeah.
We just kind of want to go through some things. We talked about traveling, right? We talked about getting back to the household chores, all that stuff. But I like to bring this topic up. It's that you are athletes and you're training for your
Yes.
sport of life, right? So how did that identity shift for you people that came into this and had never been very active before?
I mean, whoever wants to start first, like I guess we
Well,
can start with
Like I told you before, sex, drugs, and rock and roll. What it's all about, huh?
but
The the change has been now. So I started doing this because I had to do it, right?
Yeah.
Now, and then I get into doing it as a matter of a habit, because you're just doing it all the time. It's a habit. But now it's progressed beyond that, that this is who I am. Right.
Yeah.
This is every day I'm doing these, and I'm enjoying doing them. And I got to do this and this and this and this. No, first I'm doing this, and then the rest of it, I'll get to it. If I don't, too bad. This is I know I have to do this for the rest of my life.
There you go.
And it's become part of my psyche, or whatever you want to call it. It's just yeah.
This
And
is part of our lifestyle.
exactly.
Yes,
there you
there you
go.
go. Yeah.
And not just the exercises, but using your abs and glute and feet whenever you're walking, or whenever
Yeah.
you're sitting for extended periods of time. I'm like, it's gotten to the point that's not, I don't have to think about it. It's just
Yeah.
like, all of a sudden you realize you're doing it. So I think that's fantastic, because now it's not a chore. Now it's not something I have to get through. It's just, this is the most important thing. So
You made me think of
I'm
something
thinking-
here very. Yeah, Rena, you were talking about the community as well, and for example, Marianne, Bonnie, and myself, we used to fly solo at the very beginning of this journey, but then we shifted into the group coaching and then being a part of a community. So can you guys comment on how that, because I did see a big difference when you guys became a part of a community, and for example, when Marianne became a helper to others. So can you guys like talk about that difference between when it used to be just us and when you guys became a part of the community?
Yeah, big time.
Yeah. I wanted to jump in and tag on to the last question too, and kind of shift into that group thing. But you were talking about how your attitudes, like in the exercises, changed. For me, it was a complete relearning of all the stuff I had in my head that was healthy.
Yes.
Yeah.
Because what do you do in phase one? This was I was going to say phase one is the hardest phase. Why? Because what do you guys tell us in phase one? To sit down, get off your feet, use the walker.
down,
Oh my
please.
God, use the walker. That one took me about a week before I was ready to admit. And you promised me, Coach Charlie, you said it's not going to be forever. It's going to be maybe at most 2 weeks. And I thought, 2 weeks? No way. And that was the first thing I had to do, was sit down, get the swelling down. And everybody else was telling you, oh, go on a diet, just walk. Walking is really good. Like the exact opposite of what you should be doing. But I did it. You got through to me. And that was probably one of the best things. But then for me, because it helped. Yeah, I can't thank you guys enough. And then the other thing was this isn't just an exercise routine. This is about like
The lifestyle.
yes, like Coach Jay, you were talking about recovery buckets last time, and all these, like sleep. You said sleep is one of the most important things. So it's not just about go walk. That's what we're told so much. And then even the detail of explaining why cardio isn't so great. And I think, I don't know what it is, especially with women, it seems like we think that to be healthy, we have to go and, sweating away on that treadmill or the Stairmaster. And that's what you see at the gym. And that's what I mean by relearning that. I had to go, and I was still doing it. I still need the reminders, but getting on my treadmill now, I'm like, no, the weights is the most important thing. That's my priority for the day. If I have time, I can do a little walking.
And the weights are also going to be aerobic as well. If you
Exactly. Yeah.
Yes,
It
that was
does.
another thing. It's like,
Very aerobic.
heart rate's going up. But anyway, so all that, to me, that relearning, it's not just an exercise program. And as part of that, to your other question on the group calls, we get so much more on those calls. They're so helpful. Just not just the information, but to see everybody else on the call.
Yeah.
And you guys are all inspirational and amazing because you're doing it. You're not just going off and getting the surgeries and things, and you're trying. And that was really inspirational for me. And then the other big thing, just another shout out to you guys, the coaches, and Dr. David, that really impressed me was the care and the caring I saw projected on those calls. You sit there and you listen to people, you listen to what they're asking, you let them talk, and then you give them a very thoughtful answer. And so that's how.
Thank you,
That's
Christina.
true. Right?
I'll just jump in here, and I've said it before, and I'll say it again. Raul and Jay, you guys are the best there is. You really know.
Thank you, Ray.
You really know
Thank you,
your.
man.
You really know your stuff, and you really care.
Yeah.
Thank you, Ray.
But there's one thing that really bugs me about you guys. Everything you guys seem to tell us is always right. I hate when that happens.
It's true.
I hate when that happens.
I can say this, working here with Dr. David and Raul, I probably learned more here than I did in college.
Yeah.
And that
Yeah.
says a lot. There's a lot of priceless things here. And the questions you guys bring up, some people are like, oh, that's a weird question, or I'm not going to ask that. That's actually made us better focused.
Yeah.
And it's helped us a lot because some questions you're like, oh, like,
Yeah, you have
What do you-
fun there, yeah.
like Marian and I had a one-on-one, and she had some situation going on with her foot. And it took me some homework. I had to sit down with Doc, and I was like, hey, Doc, like, what can I advise her? And we went through it, and we got her moving, and
Yeah.
boom, fixed the situation.
Setbacks are part of the journey.
Yeah.
Yeah.
Setbacks are
Yes.
part of the journey. It's just not a straight road. It's bumpy.
To that point, I want to say that, like with Raul, like often, and just yesterday came up with something new for me to try. And I tried that with the side of the hip and the figure 4. Oh my God, I can't believe my whole leg was like, we've been waiting forever for you to try that. Really, it felt so much better. It's and that was just once I did it. I'm supposed to do it 3 times a day for like a month.
This is for your shoulder?
No, this is my hip and my knee. I can't do the figure 4 because my knee.
Me neither. I can't do it at all.
Guys, we are incredibly proud of you guys. We want to do this again, by the way. Like, don't think this is the last time that we do this roundtable podcast. Time went by so quick.
always goes by so quick.
I thought we were like 20 minutes in, and it's almost 40.
Yeah,
So,
I'm getting hungry.
so really enjoying talking to you guys, and we just want you guys to like share, like whoever can get it in a minute, like share some words of wisdom for anyone who's watching this video right now. Bonnie, if you could.
Okay, I got a word of wisdom. I had to learn this and it was tough. Go slow to get there faster. Don't be in a hurry to go
Yeah.
through those phases. That took me, it was so hard to learn that because I'm such a doer. I want to get done with it. And I learned it doesn't help if you push yourself too hard. So there you go.
Thank you,
Yeah.
Bonnie.
That's a big one. No, but again, thank you guys. And we're gonna have to do this again. 'Cause I feel like we're just
these are so
scratching the surface.
short. Yes.
But thank you guys for being here with us, and we do appreciate it. We'll look forward to seeing you guys again soon. And you guys watching on YouTube, come and join us. If you're having hip pain, knee arthritis,
Yeah.
come talk
Shoulder.
to us. Join
Yeah.
in with us, and we'll get it done. But thank you guys for tuning in to another episode of Joint Effort, and we'd like to thank our guests today for joining us, and we'll see you guys next time. See ya.
Okay. Take care, guys.
Bye, guys. Take care.